a healthy community is a community where people are engaged. It's like that they own it, they take it on.
I would say that a critical aspect of creating a healthy community is really learning how to listen and to trust residents.
The most important part of a healthy community is figuring out ways to create sustainability through community engagement and maybe rethinking how we conduct community engagement and what that means.
I would say that a critical aspect of creating a healthy community is the opportunity for people to share their stories and to share them in a way that they're not just going through the exercise of telling that, but that they know that they've been heard, that those stories have been listened to carefully.
I think residents know best what really affects them and how changes to their neighborhood affects their quality of life.
I think a very critical aspect of any healthy community is walkability. So basically the degree to which people can walk around that community, and not just walking for recreation or pleasure, but for for their daily needs.
People have to be able to spend time outside.
A healthy community must begin with being walkable.
It's important that people feel comfortable and excited about going out their front door and walking around their neighborhood.
But what's signature for Copenhagen is that it's under the quote of our city, vores by, that the city really belongs to the people. So
we started to look at what other people do in built environments and how healthy communities get created, and a lot of it is access to food that feels pretty easy to access and the ability to walk places, and so we tried to mimic the hospital around those things.
A lot of what we do here is really to teach students to sort of back off and just to listen.
as architects and landscape architects and urban planners is to how do we get people to participate in the design process, and how do we give the city to the people, that they take it on and own it.
How the different programs and faculty members are involved in this. Is there an open invitation? Is it truly open to everybody, or is it just for a select few? Is it for one center and not for everybody?
I think one place that we could really evolve that is to be better with cross-disciplinary and immersive experiences for our students.
I think that the medical campus addresses health in probably a pretty concrete, to use a pun, way.
We address the health and built environment nexus really through studios and seminars that are hands-on and real-world projects. So
more interaction between the disciplines in the college would create a deeper, broader, more realistic conversation about what kind of design moves we do to create that healthy community.
What the college may be able to do for the Anschutz Medical Campus is to expand that notion outside of the hospital.
So through the interdisciplinarity of the college, how architecture, landscape architecture, urban planning, urban design, historic preservation, how all of those disciplines come together, because really collectively we build and design the built environment. And so we have to really coordinate on that, because that's how the built environment gets built in the real world. It's not just one or two actors, it's numerous actors working together. So if we're going to prepare students to be city builders, we have to do it in an interdisciplinary way.
It's all about sort of learning by doing. I would love to continue this trajectory and really be seen as kind of a go-to entity in the region that can really help mediate conflicts, but also infuse sort of new and fresh thinking into debates around this important relationship between health and the built environment.
We always have to be kind of looking out for what are the new trends.
It's very important healthy design, so we've just got to try to figure out a way to bring, I think, all the players to the table.
Bringing sometimes unlike disciplines or unlike lenses to a project.
We're starting, for a number of reasons, the Accountable Care Act and maybe just a better understanding of humanity, to ask the question, how do we go upstream of healthcare or of hospitals and sick care? If we do something in a hospital, it's $1,000. If we do it in a clinic, it might be $500. If we can go out into a community and prevent that person from ever having to go to a clinic in the first place, it might only be tens of dollars, and start to ask that question of going upstream of sick care to do things that improve wellness and community, that's the future.